Good afternoon, everyone, and thank you for joining us for Our Health's Lunchtime Live. My name is Amber Van Niekerk of Our Health's marketing team, and I am joined today by Dr. Kindra Smith of Our Health Voorhees. Good afternoon, Dr. Smith.
Good afternoon.
Thank you so much for joining us. And Dr. Smith is going to be talking to us today about 6 at-home remedies and tips for battling the common cold, which we're entering cold and flu season. So this is really important information today. But before we get started, just wanted to give you a little bit of information about Our Health. Just a reminder, if you're not familiar with Our Health, we are a network of personal doctors and we are available to our patients on demand. And if you have New Jersey state or school health benefits, you have access to Our Health at no additional cost, no changes to your health insurance, and most importantly, with no copays. So you can find more information on Our Health on our website, which is scrolling at the bottom of the screen. So visit us on the website or give us a call if you have any questions. Just one other bit of housekeeping. We want to answer your questions too. So if you have questions for Dr. Smith, post them in the chat and we'll be happy to answer anything that we can. So, all right, let's get started. So Dr. Smith, thanks again for joining us today. I'm really excited to talk to you about this topic and learn more, as we've all had to deal with the common cold at some point in our lives. And, I'm always looking for ways, and so are other people, to, to find relief at home without, we can avoid a trip to the doctors. As much as we'd like to see you, we'd like to try to see what we can do at home too. So let's dive in. First, they said there's no cure for the common cold. Is that true? And if so, tell me a little bit about that.
It's absolutely true that there is no cure for the common cold. It's caused by a virus. And at this point in time, there's no medication that actually treats the multiple different viruses that cause cold. And so all you can really do is treat the symptoms.
Mm-hmm. So you said it's caused by a virus, so what does that mean? Explain that a little bit more to us.
A virus is just a type of, parasite, so to speak, that infects our cells and causes our symptoms of cold, the runny nose and the sore throat, and all the things that can come with a cold. There are multiple viruses that can cause the common cold, which makes it hard to find why we don't have treatment for it, because it's multiple viruses, including adenovirus, rhinovirus, and a common human coronavirus, not the same as the coronavirus, the novel coronavirus, SARS-CoV-2 that we're dealing with now. Completely different virus.
And so, with that, with there being so many different viruses that cause the cold, and also, now with the COVID-19, the virus, how do you know if it's the cold or, the common cold, or if it is something else?
Well, the severity of your symptoms can determine if there's something else going on, and then the length of time that you're sick for can also determine if something else is going on.
Mm-hmm. So with that being said, how long does the common cold typically last for and present itself?
So your common cold will typically last about 7 to 10 days, and then it will resolve on its own. Symptom-wise, it typically starts with a mild sore throat or irritation in the back of the throat or nasal congestion, and can go on to develop more of a runny nose, maybe some sneezing and some cough are the most common symptoms that people have.
Mm-hmm. So, with that, let's talk a little bit more about how to treat those symptoms. So what are some of those things that can provide relief?
Some of the things that you can use to treat the symptoms. So if you're having a sore throat, I'm sure you've heard people advise warm salt water gargles to help soothe the throat. Warm tea in general can be helpful, and just any warm beverage actually can be helpful with soothing a sore throat. You can treat any runny nose or congestion with a nasal saline spray or a neti pot. That's when you instill salt water into the nose to help loosen any mucus that's there. So that can help with congestion and runny nose. Cough can be soothed with over-the-counter cough medicines are helpful, and you can even use substances like honey to help soothe cough as well.
Okay.
And then multiple other over-the-counter. Oh, I'm sorry.
No, just a quick question before you continue. Just, you're talking about tea. Does it matter, herbal tea, black tea, any type of tea, or does, is there something that's a better tea for treating the cold, helping with the cold?
Herbal teas are probably better. You may want something decaffeinated. Fluids are important in the treatment of a cold. You want to make sure that you're well hydrated with lots of fluids, and vitamin C beverages, maybe like orange juice, can be helpful if you don't have any reason to not be able to drink orange juice. The caffeine can sometimes cause a slight dehydration. It's a diuretic, so it can make you pee. And so you may want to just stick with your herbal teas
Okay.
as opposed to black tea or green tea, just something decaffeinated.
Okay. And I think you were going to add something else before I asked about the tea.
Oh yeah, regular over-the-counter cold medicines. If you don't have any medical condition or allergies to something like a guaifenesin, which helps with cough suppression, or dextromethorphan. I have a hard time saying that one. The DM in Robitussin DM, that's like an expectorant to help get that mucus out. Those things can be helpful. If your symptoms are bothersome, if you're having a cough that's keeping you awake at night, that would be a reason to take something a little stronger than a home remedy.
Okay. And again, just a reminder to folks who are watching us, please post any questions that you have in the chat, and we'll be happy to answer. One other question that I have for you is people often get confused and think that a cold can be treated with antibiotics and might, come to you asking for antibiotics. Can you tell us why that doesn't work?
Well, antibiotics specifically target bacteria, and because bacteria are a different organism than viruses are, and so antibiotics won't work on viruses. So they specifically only treat bacterial infections.
So we're not gonna solve the common cold virus with any of those
with
viruses.
The Z-Pack, right?
Yeah. Unfortunately, there's not that instant relief there.
No, unfortunately, you just kind of have to sweat it out, so to speak.
Yeah. Another thing that you had mentioned to me is that there's certain foods to avoid with when you have the common cold. So, what are some of those things? Are there foods that you should avoid and foods that you should think of to help?
Main things to avoid would potentially be your caffeinated beverages. You want avoiding dehydration. You don't necessarily have to avoid anything. If you're having postnasal drip, the drainage down the back of your throat that's making you feel nauseous, you might not want to eat anything heavy. There's old wives' tales of no dairy. Dairy is mucus causing, but there's really no science behind that. So there's no reason to restrict dairy, really. Dairy's fine. If you want to have a dairy product, it's fine. If you personally find that dairy creates mucus in you, then you may want to avoid it, but there's really no reason to in general. Alcohol you want to avoid also can be dehydrating as well and can potentially interact with any over-the-counter cough medicines that you may take.
And what about, we're talking a lot about treating the symptoms, but especially right now as we're trying to avoid respiratory issues in general, with the COVID-19 pandemic, how do we prevent the cold or really any other viruses from starting?
All the things that we've been hearing since the start of this pandemic have always been true for the prevention of viral infections. So we're talking about hand washing. Soap and water is always best. If you don't have access to soap and water, then an alcohol-based hand sanitizer is the next best thing. So keeping your hands clean is honestly the most important thing. Avoiding touching your face. Cold viruses can stay on surfaces, doorknobs and tables and chairs and subways. And so touching something, getting that virus on your hands and touching your face is the main way that most of us get infected. Also through droplets, people coughing, people sneezing. So again, as we've been hearing, cover your coughs and sneezes. Try to stay socially distant from people that may be sick. So those are avoidance really is the best way.
Staying home if you're sick.
And absolutely staying home if you're sick. So if you're having a cold symptom, stay home. Or if your symptoms are mild, and I understand that not everybody can always stay home for something minor, and things are a little bit trickier now with COVID. But if you otherwise, if you're not having any fevers and, you just have the sniffles or allergy-like symptoms, you got to make sure that, now wear your mask. Make sure that you're wearing your mask, doing your best to stay socially distant, and then completely covering your coughs and sneezes. It's the best way to prevent spreading to other people if you're sick, be it the common cold, influenza, or coronavirus.
What are your top things that you look to do for yourself to, if you start to feel the cold coming on, to make sure that you're keeping it at bay as much as possible?
So personally, if I feel like I'm coming down with something, I do like to do like a zinc lozenge or like a Zicam.
Mhm.
Um, you have to do them so consistently, and some of them don't really taste good. So I'm not always very consistent with it. Sometimes that can kind of nip it in the bud. But if you've got kids at home that frequently bring home germs,
Yeah.
at least in the past, they brought home germs when they were in school. Um, so if it's really coming on, I do the warm salt water gargles. I do the tea with lemon and honey. I try to make sure that I'm staying well hydrated. I cover my coughs and sneezes. I make sure I wear my mask. Um, I wash my hands frequently. I try to avoid being around people unnecessarily, any unnecessary interactions with folks or visits with people. Um,
Mhm.
and then if I need something, then I try some over-the-counter medicine depending on what symptoms I'm having. But I try to avoid taking any medication if I really don't have to.
Mhm. And so
Yeah.
when if someone is, their symptoms are starting to get, maybe a little bit more intense, at what point should they contact you to contact the doctor?
Oh, I see my video is gone.
I was going to say, did we
Um,
lose did
can
we
you still
lose
hear
you?
me?
I can hear you, but we lost seeing you.
Oh gosh, this happened the last time.
I know.
So, um, what you can do, I'm sorry, repeat that question. I got thrown off by the camera
No,
going off.
no worries. Technical difficulties are fun. So my question was, at what point should a person contact their doctor or, contact you?
Yes. So if your symptoms are lasting more than 7 to 10 days, you may want to contact your doctor. If earlier than 7 to 10 days, you're developing really high fever, say over 103, 104 temperatures, if you're having shortness of breath,
Mhm.
if you're having chest discomfort, if you're having severe headache, or any unusual symptoms, nowadays, unusual symptoms we think of would be loss of taste or smell. That's one of those symptoms that's concerning for COVID. Um, Anything unusual, then you should reach out to your doctor. And it's
Mhm.
fine. I have plenty of patients that reach out to me, 2, 3 days into an upper respiratory infection. And that's fine. It puts it on my radar that this person isn't feeling well. And then I
Mhm.
can always make sure that I check in and I can advise them, hey, if you're not feeling any better in the next day or two, or
Mhm.
longer, depending on their symptoms, reach out to me and let me know how you're feeling.
Yeah, I think that's really important, just having access to contact someone. And,
Mhm.
specific to our health, what are some of the ways that people can contact you with, without having to come into the office right now?
Oh, the Spruce app is like the best thing ever because you can just shoot a quick text message securely. Hey doc, I've got these symptoms. What do you think is going on? And I'm checking those messages and responding as soon as I can. With advice. I can actually give you advice on how you're feeling, and we can do that virtually without, you don't have to phone call. You don't have to make that phone call. And then if you did want to call, you can call the office. My staff is here to take your calls and questions. They filter anything through me. And then if I'm available, you'll actually get to speak to me.
Yeah.
So you
And I
catch
think
me
that,
between patients.
yeah, and I think getting people started early, through that connection on Spruce you can start with them with some of those at-home remedies, right? Instead of waiting for it to get more severe when they finally contact you. And then, it's a little bit too, it might be more difficult to treat at that point.
Mhm.
So, anything else that you'd want to add? Just, things that we should be thinking about with, as we enter cold and flu season, Dr. Smith.
I think we just need to be very diligent in wearing our masks and doing our best to social distance. I know some of us have a little bit of COVID fatigue, and I totally get that. But we want to be mindful that the virus is still out there, patients are still getting infected, and people are still out there dying. So we're coming into flu season, so we have to deal with routine common colds that are still out there, influenza, as well as the COVID virus that's going around. And so, hand washing, make sure you're washing your hands, keeping some hand sanitizer on you, wearing your mask when you're out in public and you're not able to social distance, limiting going out to gatherings. The fewer people you expose yourself to, the better.
Mhm.
Um, that's really, really the case. These small gatherings are becoming kind of hotspots. And so, just limiting who you're exposing yourself to while still finding ways to stay connected. Because I
So
think
important.
staying connected is really important for our emotional and our mental well-being. So finding ways to stay connected, schedule a weekly Zoom call with family or friends. I know it's not quite the same thing, but you can still, social distance, take advantage of the fact that it's not really cold out yet. You can still have social distancing, gatherings with, close relatives, staying 6 feet apart, staying outside, and with your masks on are the safest ways to do it.
Yeah.
This virus has taken a toll on us in so many ways.
Yeah. Just with that being said, you had mentioned, flu season. Do you want to give a little plug about the flu shot this year and its importance, especially this year?
Yeah, I think getting vaccinated for flu is really, really important in general. I mean, thousands of people die of the flu every year. And it's preventable. We know that the flu virus isn't 100% effective, but it can be very effective in preventing you from getting the flu, and also prevent you from getting severely ill if you do get the flu despite being vaccinated. So
Yep.
we still have flu shots here. If anyone is interested in scheduling for a flu shot, please contact the office. We still have plenty of doses here, and we're vaccinating people every day. I got my flu shot, took my kids for their flu shot this week.
Yep. And if you, just a reminder, if you're a member of our health, we can give you free flu shots at our practice. If you're not a member, but you have access through the New Jersey state or school health benefits, you can also contact us to get a flu shot at one of our practices. Dr. Smith is obviously at Voorhees, but we have practices throughout New Jersey. We had a great comment coming in. Just a reminder, just a plea, wear your mask, and we couldn't agree more. So thank you for posting that, CWA 1033. So another question coming in. I typically get a sore throat when I get sick. Any specific brand of cough drops that you recommend as we are dealing with those sore throats and common colds? And again, apologies that we lost Dr. Smith's video, but she's still here with us. So
I'm still here. No, I don't have any particular brand. I'm Old Faithful Halls. I'm still a Halls person, so I still have Halls. I keep cough drops. I'm like an old lady. I keep cough drops in my purse. They're in my drawer at work. They're in a drawer in the office. So I still use Halls cough drops because they're kind of tried and true.
Yeah, so great advice. So again, just final reminder before we wrap up, any other questions, please post them in the chat. We're happy to answer. Dr. Smith is here, even though we can't see her. And we're happy to, to just continue answering questions. So we'll just give it another minute before we wrap up.
Yeah, shout out to CWA Local 1033. That's right, wear your mask. Absolutely.
Absolutely. All right. Well, I think that's probably it for today, Dr. Smith. Anything else? Any final words other than wear your mask, stay safe?
Wear your mask, wash your hands, and that's really it, and do the best you can to keep yourself safe and keep your family safe. It's really important. And still try to find ways to be active, and keeping yourself healthy in general is really, really important. So if you haven't scheduled your routine well care or a follow-up chronic disease visit, come in and see me for your hypertension and diabetes. Those things put you at, when they're uncontrolled, they put you at increased risk of worse infections. And so really, really important that you keep up with your routine care. We've been here the whole time, even if it was only virtually. So reach out to me if you're due for a visit.
Yep, we want to make sure we're staying on top of that preventative care, not just dealing with things as they come up. And all of our health doctors, including Dr. Smith, are there for that. So Dr. Smith, thank you so much again for joining us today. Thank you to everyone who joined us for our lunchtime live. As always, if you have any questions, if you're interested in more information on our health, visit our website, scrolling below, call us at the 800 number also there. Thank you so much and enjoy the rest of your day. Thanks,
Thank you.
Dr. Smith.
Thank you so much. Have a great day. Be well, everyone.